Thank you all for standing by, and welcome to the fourth webinar of our fall series entitled One Health, the Dynamics of the Human-Animal Interface in a Rapidly Changing Environment. These webinars are an initiative of the Ohio State University Climate Change Outreach Team, a multi-departmental effort within the university led by OSU Extension, Ohio Sea Grant, Bird Polar Research Center, and 6 other OSU departments to help localize the climate change issue for Ohioans and Great Lakes residents. I am Jill Gentis-Vanicki from Ohio Sea Grant and Stone Laboratory, and joining me today is Dr. Lonnie King from the Ohio State University. Dr. King is the Dean of the College of Veterinary Medicine at The Ohio State University. He also serves as the Executive Dean of the 7 Health Science Colleges at Ohio State, as well as the Lead Dean for the Public Health Preparedness for Infectious Diseases program. Prior to coming to Ohio State, Dr. King directed the National Center for Zoonotic, Vector-Borne, and Enteric Diseases at the Centers for Disease Control and Prevention. He served Michigan State University as Dean for 10 years, and prior to that spent 19 years with the U.S. Department of Agriculture in the Animal and Plant Health Inspection Service. As the nation's chief veterinarian, he worked extensively in global trade agreements and has testified before Congress on issues of emerging diseases. A member of the National Academy of Sciences, Dr. King is board certified by the American College of Veterinary Preventive Medicine and is an expert in One Health and emerging infectious diseases. We're delighted to have Dr. King here today to discuss the concept of One Health, exploring the links between humans, animals, and the environment. Before we do that, a few logistical issues as we get started. During our presentation, all participants will be in a listen-only mode. Afterwards, around 12:45, we'll conduct a question and answer session. If you would like to ask a question during the presentation, please feel free to use the chat feature located on the right-hand side of your screen, and I'll collect and pose your questions out to Dr. King at the end of his presentation. We have more than 150 participants on this webinar, a great diverse group representing governmental agencies, academia, and nonprofit groups from the Great Lakes and around the country. Please keep those questions coming throughout the presentation. We should have a great Q&A session. As a reminder, this webinar is being recorded and will be posted onto our website for later viewing. Also, we will post a webinar survey in the chat feature toward the end of the hour. Please take a few minutes after the webinar to fill out that survey. It will help us continue to bring you better webinars. Without any further delay, I'd like to introduce Dr. Lonnie King from The Ohio State University, who will present One Health, the dynamics of the human-animal interface in a rapidly changing environment.
It's a pleasure for me to be involved in this series, and Jill, thank you for the opportunity to be involved. For the folks on the screen, here are the objectives for this presentation. It's to discuss the driving forces and the dynamics at the human-animal interface, to review the new world of emerging infectious diseases, especially focusing at the human-animal interface and the consequences of what's happening at this new interface, to discuss the importance of animals to human health, and to make the case for a changing paradigm and how we need to look at this, and that is one of One Health, which we will define in this presentation, to review recommendations then to address the threat of pathogens that are emerging out of this new human-animal interface. To do this, we need to kind of push the button and rewind, and we'll go back 8 to 10,000 years ago during one of the first historical epidemiologic transitions. And right before this, what had happened is that there were hunters and gatherers, and 8 or 10,000 years ago was the time there was an advent of agriculture. And that created a real new social order and also the domestication of animals. So that was one of the first times that large numbers of animals then came into contact at a new human-animal interface with people. We saw that point in time new infectious diseases and new epidemics that emerged. Jared Diamond, in his book Guns, Germs, and Steel, actually refers then to deadly gifts. So the gifts from animal origins like rinderpest and mycobacterium, which was the early form of tuberculosis, cowpox, which probably led to smallpox, types of influenza, pertussis, and malaria, all had animal origins And it was that interface during 8,000 years ago when animals became domesticated, and the new interface then created the first of this group of diseases. So what we're really talking about, 8,000 years later is a time now what I think we almost see a repeat of this interface in ways that we've not seen before. So as we then move into more contemporary life, what really happened then in the next transition was chronic diseases, and now we're in the third transition, which probably started approximately 30 years ago. And that was a time that we saw new emerging infectious diseases that were creating for the first time increases of death in infectious diseases in human populations that we haven't seen since the 19th century. So organisms changed, diseases emerged, they reemerged, they're becoming resistant to antimicrobial agents, and 3/4 of these new diseases are agents that go from animals or from or through animals to people. So we call this group of diseases zoonotic diseases. And the Institute of Medicine then speaks of this as a new convergence model of animals, people, and the environment that have created a perfect microbial storm, if you will. And the genetic, biological factors, physical, environmental factors, ecological factors, social, political, and economic factors have come together and have created the right environment to then really have this perfect microbial storm that we've never seen before. And the result of that has been the new group of emerging infectious diseases that we saw really accelerating beginning 30 years ago and are continuing today. So these diseases are emerging in unprecedented time frames because of the changes in microbial adaptation. This has happened for millennia, but we're giving organisms now greater opportunities to change, to adapt, and to give them really a strategic advantage. Our environment is changing, our climate, our weather. This whole series that Jill has set up that talks about potential climate change and environmental change is one of these factors. And changing ecosystems, changing dynamics of people and their behavior, we'll touch on that in a minute. International travel, poverty and diseases that really track toward populations that are highly susceptible, and also a new world of, unfortunately, bioterrorism that we worry about as well. So it really is a brand new era. So we think of this convergence then as a kaleidoscope. A kaleidoscope was a toy of a real kind of telescope where you have pieces of glass in it, and as you turn that, you get different visions every time you make a slight turn. So this is just pictorially looking then at human health, animal health, and environmental health, and what that convergence looks like, and how rapidly then that the picture really changes. So what's the evidence behind this? Well, here's a slide that depicts the CDC's most significant global epidemics over the last 15 years. And if you take a look at these from hantavirus early on to Cryptococcosis Gattii last year, what you really see then is a group of diseases, all of which are zoonotic. So that means that every disease listed as significant global epidemics over the last 15 years really have an animal origin. And it's really important as we understand public health in contemporary terms to understand that connection and at the interface of human and animal health. And this really is the evidence as we move forward. There was an analysis done several years ago by a group of scientists in the United Kingdom that looked at what infectious diseases might hold over a period of a decade or two. Their findings were that emerging infectious diseases are no longer kind of accidents. They really are the new normal. And we should expect, according to their analysis, 3 or 4 new emerging infectious diseases to pop up every year. This was done a few years ago, and so they estimated anywhere from 8 to 34 new diseases by 2015, and we're well on our way to achieve that. If you go back since 1980, which was really kind of the start of this new era, you look at 87 new emerging infectious diseases. 58 of those were viral diseases, and of those viral diseases, the majority were RNA viruses, most of which were zoonotic, coming from animals. These diseases and organisms are found worldwide, but the proximity of animal populations or products to people is really the key risk factor. That is the new interface or nexus of human health and animal health. And they predict that the change then that we're seeing with pathogens and the ecosystems are really the most important single driver that will predict new emerging infectious diseases or re-emerging diseases as we move forward. For those of us that have been involved in veterinary medicine, I remember as a practitioner being on farms a number of years ago, if I would go on a farm, a lot of these farms had multiple species. And it was very common then to look and understand how easily these organisms spread from one species of animals to another. So that spread is pathogens that are capable of crossing species lines. So we really talk about that as multi-host pathogens. That is, they infect more than one species. And 80% of the pathogens we deal with in animal health or in veterinary medicine are multi-host pathogens. But what we're finding today is of the almost 1,500 human pathogens that we know of, and by the way, there's many more than that we know of, 60% of these human pathogens are zoonotic. So now the understanding of human and animal health coming together in ways that we have to have a better understanding and better approaches as we look at these diseases. And that really was then kind of the genesis of the comeback of the term One Health. And the winners are ecological generalists. Those are organisms that cross species lines easily, that adapt, that move across the world, and certainly are able to infect one species to another. So in the world of microbes, this is what some people call the Club Med of microbes. They're happier than they've ever been. They've had great opportunities now to change from one species to another because there are more opportunities, more animals and people in the world, and the interface of animals and people is accelerating and intensifying. So we also see antimicrobial resistance. We see the movement of these pathogens through trade and movements of people and animals around the world in ways that we've not seen before. So these organisms and pathogens really have the upper hand right now. And even though we are proud of having new vaccines and great healthcare systems, you really look at what's happening globally in microbes and in disease emergence. They really have the upper hand and are gaining with new niches as we move along. So we really think of this as a triple threat to health. It's a triple threat because it's a threat to our human health. They're vulnerable. It's a threat because of our environment is changing and being threatened. And it's a threat to our animals who are carrying these diseases, but they themselves are also being contaminated, if you will, with a new group of emerging diseases because of their movements too. So let's take a quick look at what's happening in human health as we're part of this convergence of human animals and our environment. This just takes a look at trends in global health, and maybe we'll try to take a look at of a pointer here. So this is 1950 and the Bureau of Census, and it goes to 2015. So this is real growth in terms of human health, and you know we've just hit 7 billion. Looking at 2015 as we're moving from 7 billion to 8 billion people on the face of the earth. What we really see then as another trend is the darker parts of these graphs really represent then the change in developed countries. The lighter color, the reddish color, then represent the changes of human populations in developing countries. And this graph depicts very nicely then what we see that 90% of the world's population then is taking place in the developing world. These are areas of the world that we're worried about their ability to have infrastructures to handle human and animal health outbreaks, to have early detection systems and surveillance systems that we really need to pretty much protect us all as we move forward. So in addition, if we take a look at how many people are moving worldwide, so every year now we are over 1 billion people, and this graph just shows the movement of people in terms of international travel from 1950 to 2020. And as we move ahead, you see the rapid rise and increase in international travel from today into 2020. And most of this movement is taking place in Southeast Asia, the Middle East, and Africa, the very areas that we think are enormously vulnerable as we move ahead. So it's important then to know that this is what's happening. The other part of this increase in movements of people is that we now have more people living in city and urban populations than we do in rural settings, and that took place several years ago. And the biggest increase in populations of humans worldwide are really going to be in the 25 largest cities in the developing world. And unfortunately, the fastest growing parts of these are really slum areas, what we call peri-urban settings. And this peri-urban setting really then represents a new opportunity, if you will, for human-animal interface and being part of the changing environment. So we know that people are traveling worldwide, so we look at super vectors as not being mosquitoes and ticks, but also people on board of ships and on airlines that are moving around the world in unprecedented ways. There's a picture on this that doesn't show up, but there's a concept called diasporas. And a diaspora is a changing location of a population. That population may be a human population, it may be an animal population. It represents immigration, it represents the movement of people, and people are reestablishing and migrating in new populations worldwide. So diasporas then represent the new formation of these groups. There's a whole science that talks about movement ecology, that talks about migration and immigration and how that impacts public health, travel and trade. The human microbiome is what we are transmitting in our own guts as we do international travel, which also add then to the movement of pathogens and antimicrobial resistance. The remarkable global food systems and these transboundary diseases are the diseases that go from animals to people. So just quickly, in human demographics, the huge migration and dislocation of people we've never seen before, the increase in peri-urban settings, the increase in the number of people who are compromised, potentially immunologically, as we have older populations and as we have people being treated for cancer, et cetera, are much more susceptible to these pathogens. People are being exposed to wildlife and vectors more, their habits of recreation, the foods that they eat, et cetera, are part of the changes that move us forward in One Health. So let's just take a quick look at through the lens of animal health as we look at this convergence in our kaleidoscope. So last year, almost 30 billion, that's a B, 30 billion food animals were produced to help feed this population of the world that's now over 7 billion people. And that has resulted in literally trillions of pounds of products being distributed worldwide. We've never seen anything like this before. And the FAO, the United Nations, projects that in the next decade to 2 decades, that there will be a demand for food from animal protein by at least 50%. And this demand for proteins from animal sources will be primarily in the developing countries. As people increase in wealth, they also increase in changing their lifestyles. One of their changes then is to go ahead and look at proteins from animal sources as one of their primary parts of the nutrition, for good or for bad. This graph just looks at meat consumption from 1983 projected into 2020. The red line then really takes a look at, if you will, the meat consumption from 1983 projected into 2020 in the developing world. And you can see the rapid increase then in the use of protein and protein sources into human diets. And this blue line is the increase of meat consumption in the developed world. Together, these mean that there'll be over 300 million tons of meat and animal products that will be used worldwide. So it's incredible. And, what do we think then that might possibly happen in terms of our food supply, foodborne illnesses, and waterborne illnesses? This takes a look at poultry populations or density in Southeast Asia, looking at, on the left, poultry population density, and on the right would be human population density. And if you put those together, they coalesce very nicely. So what is really happening then is people and animals are moving closer together. This is kind of a complex slide, but it is demonstrating how quickly then populations are moving toward animals and humans. So the point right here would be the center of one of these peri-urban settings. In this case, it's Bangkok, but all of them fit this same line. If you look at this line then is a movement of people closer and closer to the middle of the city. And so you can see how fast people now are moving toward the cities. This is the growth of chicken populations toward cities. This then is the growth of hog populations toward cities, and the rest of these really represent soybean and maize and other products. So there's a complete shift of animal products towards city centers, if you will, which are creating whole new environments and possibilities then for a new convergence of animals and people that we've never seen before. So new risks are taking place. This is a picture taken out of Nairobi, where we really have a new form of agriculture that is being started in these peri-urban areas. New opportunities at the human-animal interface for pathogens to change as we move forward. This is a chart that looks at risk. So this is 1970. This axis shows the number of events or catastrophic events. The red line is man-made disasters. The blue line are natural disasters or catastrophes. And you can see at about 1980 on how our risk levels changed, both man-made and natural. And this was about the same timing that we saw with this new era of emerging infectious diseases. So we live in a riskier world. To take a look at our ecosystems, they are changing not for the better. Humans have changed inexorably at least 50% of the land mass worldwide. Whether we dam rivers or cut down forests or create pollution, we are also creating microcosms and new environments for microorganisms. Part of these of which are waterborne diseases, which I think have a whole new era ahead of us, where water then becomes the environment for the mixture of animals and humans and the creation of a way of distributing new pathogens. So worldwide, waterborne zoonoses, diseases from animals that are transmitted through our water supply, are also increasing very rapidly. 4 billion cases of human diarrhea per year, resulting in 2 or 3 million deaths, mostly in young children under 5. They're poorly reported. We're just now getting a handle on how important these are going to be. And as our environment changes, we then are pushing, if you will, ecological systems closer together. And the transition or the edge of one ecosystem or environment that abuts and actually comes up against another ecosystem is called an ecotone. And it is the line or the demarcation between ecosystems that then are the hot zones, if you will, for the creation of new opportunities for pathogens to emerge. And a good example of that is Lyme disease. and Lyme disease is Borrelia burgdorferi. This is just the slide that shows the transition of a town. This one's in Connecticut, but it could be in Vermont. In Connecticut, it's where we actually saw the genesis of Lyme. But here's an opportunity where forests grew up over 100 years ago. They were cut down for agriculture, and now the forests are coming back. If you look at a picture toward the end of the 1980s, and what's happened with the regrowth of forests, or people then are moving into areas where these new ecotones exist. And so white-tailed deer and rodents and ticks then become part of the risk factor and the human population's risk as they move forward. And they are getting infected with Lyme disease in record numbers. So this year we would anticipate almost 30,000 new cases of Lyme disease just in the United States. And Lyme is the fastest growing zoonotic disease in Europe. So let's take a look of a projection of what will happen in Lyme if we see the same ecological, climate, and sociological changes that we see, and now move those into the future by a number of decades, and realize that these are projections and they're really guesstimates. But the picture that with the eastern United States shows the red and blue are really new ecological settings where Lyme disease could be transmitted to people. So it is a typical part of an ecotone of how the climate will actually change then and add to this human-animal dimension. These can be man-made as well as natural. So this is just the understanding that new roads, for example, this new route that goes from Thailand all the way to China, will go through literally dozens of communities and villages along the way, and will expose them as man-made ecotones to travel, trade, new products, and new potential exposures. And these are going to be areas that we'll need to watch very closely into new emerging diseases. And part of that emergence or disease like dengue, which is a viral disease passed by mosquitoes, that is really a worldwide epidemic. And if you just take a look of how rapidly dengue then is changing from 1995 really to less than 1,000 cases till looking today, and I can tell you that there will be over 1 million cases of dengue. So rapid changes in our ecosystems, and dengue is part of that. So since this is really talking about, in part, our environment and climate change, we'll take a look at an organism called Cryptococcosis. Cryptococcosis is a fungus. It's distributed worldwide. It is responsible for a lot of diseases in sub-Saharan Africa and the cause of meningitis, especially in populations with HIV/AIDS. And this is Cryptococcosis neoformans. There's another form of Cryptococcosis, which is Cryptococcosis Gattii, and it has also emerged as a new pathogen. And what used to be prevalent in tropical, subtropical regions as part of the environment has now emerged in temperate Vancouver Island, so northwest United States and southwest Canada. And most people believe that Cryptococcosis gattii has moved into northwest United States and exchanged and increased its range from eucalyptus trees to fir trees based on perhaps partly climate change in this part of the world, movements of animal populations and people, and a new dispersal of this organism. And this just shows how quickly a disease can spread. So these are human and animal cases in this part of the world, in northwest U.S. and in Canada. And it really shows then the distribution of Cryptococcosis in British Columbia moving toward northwest United States. So the red are the human cases, the blue are the animal cases, and the pink represent changes in the ecosystem that are taking place. So what has happened is with this first detection of Cryptococcosis gattii, we now see that the environment is literally infected with this new fungus. And it has really got a new niche, and that niche, in part, then has created new opportunities for this organism to infect not only humans, but animals, both companion animals as well as food animals. And also it has included cases in dogs and cats. So I think it's a great example of what this interface and changes in the environment will do. So a few years back, we knew of SARS, and SARS, is a coronavirus. We know coronaviruses in animals all the time. It infects food animals. It causes respiratory and intestinal diseases. And with SARS, we saw the switch of this organism in southern China, where we actually saw this organism leap across species from at an establishment called wet markets, where people went and looked at live animals, had them slaughtered. So you had a whole group of animals together and people. The transboundary of movement of this virus then to civet cats are in the upper left, which was the amplifying host, then into humans. The origin was really a bat called a horseshoe bat, which was asymptomatic, but used as a source of food, and that really was the origin to that. So what we learned from SARS was the huge economic impact of these zoonotic diseases. So SARS infected almost 8,000 people, caused 800 deaths, but it caused billions of dollars of economic devastation, not just in lack of movements of animals, but in transportation, travel, in the world of people taking vacations, and it impacted a whole business sector. This graph just shows, the estimated cost of diseases and how expensive avian influenzas or SARS would be as we move forward. But there are huge economic consequences to this group of diseases. And we know that at the human-animal interface is where also new influenzas start. And these influenzas are likely started in populations like we see in Southeast Asia, southern China, with ducks and people and poultry and pigs, where the influenza virus is capable of infecting all of these species and humans, exchanging the genome. And we are really kind of waiting then for what the next pandemic might be, and the fear that that's actually created. So if we look at the influenza virus of H1N1 and see how it has evolved, we see a genome that was partly from hogs from North America, partly from birds, also from North America, partly from another influenza virus, partly from Eurasia, from hog populations, and partly unknown, to create really a virus then that transmitted from animals to people and was able to go from person to person to person to cause that pandemic. We were very fortunate that it didn't have a real serious clinical complication. So we worry about what the next pandemic is, like 1918, 1919, that really had serious consequences to human morbidity and mortality. Just kind of quickly, I wanted to touch on this connection then of people and animals. Livestock worldwide contribute really to the livelihood of 70% of the world's poor. And it's estimated that there are 800 million people worldwide who keep small numbers of livestock or poultry and are really critical to their well-being economically. So this is very typical in an African community of how important animals and animal products are to their lives. And it has really created a group of what we call neglected zoonotic diseases, or diseases here again at the interface of human and animals, where animals are so closely interfaced with humans. I mean, animals become part of their life, They live with humans. They interact with humans on a daily basis. And what we really need to start understanding is a way of looking at this in a new way. So this is really about One Health. It's the collaborative, holistic, integrated way of looking at human health and animal health so that these diseases, such as anthrax and TB in animals and brucellosis, rabies, Epidemic examples, and here are a few more from Bartonella to leptospirosis, really then are creating new diseases as part of the new emerging disease groups. And the crux of the problem that for many of these animal diseases, right, the risk to human health is really important, but the most effective control measure is animals themselves. So what happens is that human and animal health becomes separated, and we have 55,000 people today dying of human rabies. Well, the way of handling that is actually the prevention of rabies then in wild dogs or wild dog populations, and that's where the prevention is. So that's why we need to move to this One Health interpretation. So what is it that we can do about it? Well, we can more successfully work then at the human-animal environmental interface. And for folks on this presentation looking in, I would say this is part of our key challenges, right? To understand that we have to work across disciplines, across professions. So each sector, whether it's human health, animal health, or environmental health, really doesn't know enough by themselves or within their domain to solve these complex problems. So it's time then to come together and do this in an integrated way. The continuum in human and animal health are coming closer and closer together. We need to shift our attention upstream. That means we need to change our attention not just from human illness and what's happening in our hospitals, but also is where this organism started, what the interface is, because that will change then our intervention strategies, which will make it closer to our sources and more effective. So a new appreciation for infectious disease ecology, that we know new diasporas and ecotones are being created all the time. And rather than being passive or reactive, we know that events are going to take place. And these are areas that we need then to be more aware, have better surveillance, and better response systems. We need to develop community health teams, not fragmented teams working alone. They have to have new skills and knowledge. We need to shift toward prevention, which is really the essence of a One Health mindset, right? So we think of One Health then as the following. One Health is the collaborative effort of multiple disciplines, whether we're working locally, nationally, or globally, to attain optimal health of humans, of animals, and our environment, and do this together rather than individually. And that's the importance of this new paradigm as we're moving forward. Well, why is One Health important today? And by the way, it's not a new concept. It's a concept that was appreciated in the beginning of last century. And it's more important today because our world is now interconnected. What happens overseas impacts us and vice versa. So it really is a global village. We live in an era of triple threat to health. So our environment's being threatened, our human health's threatened, our animal health's threatened. And we now find out that they are threatened together. And to do something that was positive in any one of those three domains could very well be a positive outcome for the other two. Our era of emerging infectious diseases is not about to let up. All of the factors that created the perfect microbial storm are in place. So if you remember those graphs that are going up and how threatened our world is, there's nothing out there that would suggest that this is going to change. We're going to have more and more of these diseases, which means that we need to convert to a One Health strategy and understanding because that is part of our world. You're going to see changes in food safety and security with really millions of tons of food and animal produce trying to increase to feed the world global population. New vector-borne diseases, so these are ticks and mosquitoes and lice that are also being transmitted and they are part of a changing ecosystem themselves. And we really are concerned then about climate change and how this can impact both positively and negatively on the populations and the movements of these vectors. So that is a consequence of climate change. The new ecology, if you will, of understanding the roles of these three domains, the intensification and acceleration of human-animal interface, and that we can't just move forward without making any adjustments to our strategy. We now need to shift to different innovations at different points. So as we close this, this is kind of the essence if you think about what we can do in One Health. And just take a look at this schematic then, if you will. So, so this is, let me see if we maybe got this right. Let me just change this to the next one real quickly. So this is typical of what we see today. What we see today then is, if you look at this, would be the number of cases, these animals or people. This axis is time, number of days. And so what we find is that when we get a new disease, we see the disease transmitting from animal to animal, either through ticks or vectors or directly from animals or their foods, increasing the number of cases with time. That outbreak peaks. It then drops down depending on how fast the organism will move from species to species. And we call this an epidemic curve. So this is pretty typical of most any infectious disease. If it's zoonotic, we see then that the diseases from animals, where there's an amplification, also shift over to humans. And they have the same epidemic curve with an amplification, a peaking, and a fall-off. And this is the sequence in which that happens. So what we want to do then in One Health as we move forward is to change then when we get involved in this epidemic curve. Right? So what this depicts is before we see a start of a disease, and before it starts to increase in the number of cases, we now have the ability and the tools to detect them much earlier. Right? We can do diagnostics in animal populations and understanding what might be available to human populations that we could prepare earlier. We could see weather and climate change in Eastern Africa, knowing that with new sources of water, we're going to get increase in mosquito populations, increase in diseases like West Nile virus, and the animals can move over into humans, and we're off and running. So it's very important now with One Health to do an early detection. The earlier the detection in human cases and animal cases, the lower than the number of overall cases. So we are lowering the epidemic curve. So instead of going all the way up to the top with a very large number of cases over time, we're really kind of decreasing that curve, if you will. We're decreasing the exposures to humans, so the epidemic curve is minimal here, or even prevent it at all. And because we moved everything forward to early detection and having the capability to respond, our control opportunities take place much sooner, and we can dampen then the effects of these epidemics as we move forward. You cannot do this if you just look at human health by itself. So that's why it's so important to what we call moving upstream, a new public health paradigm, not just looking at human cases, but now moving to the left, new outbreak investigations, looking at environment, looking at animals as potential opportunities at the interface for spread of disease, and preventing these things happening at a very early stage so that we don't get human cases or don't potentially get animal cases. So there are really challenging times in which we live. The impact and influence is beyond human and animal health. It's about trade, it's about goods and services, and it's about the devastation of economies, not just the human health outcomes, which are important in themselves. So these aren't individual problems. They're dilemmas that have to be managed in terms of an integrated strategy. We have to understand that we move from being independent to interdependent, and our connectivity means that we have to change. The microbial storm increases in intensity with new emerging infectious diseases coming forward. And we really have to reconcile how we work and how we work together, which is really a One Health mindset as we go ahead. The final two slides here are really kind of a consensus of recommendations that are kind of a meta-analysis, if you will, of what we ought to do, and people have put these together from a lot of different strategies and to say, here's the way that we ought to approach this. So we need to improve, first of all, not only infrastructures in human health, but in animal health. Because we know now if we can improve animal health, we also will improve human health. And that is a recognition that's really important. We need to integrate surveillance strategies and diagnostics, not exclusively in humans. It's also in looking at surveillance of our environment, of our food, of our water, of our animal populations, so that we can have earlier detection and better response. There needs to be an increase in research and development. There needs to be a new focus on prevention, not just reaction. We need to build a new infectious disease workforce that's multidisciplinary, that respects these three domains. This all needs to be considered really in a global population as we move forward. We need to improve then disease reporting, new interventional strategies, create zoonoses and emerging infectious disease centers, and meet the critical needs for new leadership and skills as we move forward. So that's kind of and I realize that was pretty quick, but a look at One Health, why it's important in our strategies as we move forward into the new domains of humans, animals, environment, and how we work together. So Joe, I'm going to stop there, and I'm pleased if there's any questions as we move ahead.
Thank you, Dr. King. That was really great. We've gotten some fantastic questions during the presentation, so let me get started and ask Dr. King as many as we can. The first question that we have is, how does the antibiotic use in livestock play into the larger problem of human-animal disease transmission? And if it is a problem, what are the steps to alleviate it?
A great question, and I think it really leads to this idea of One Health. So, I think the use of antibiotics in feed for millions of animals certainly leads to the possibility of adaptation of these organisms into new strains. The use of an overuse of antibiotics by physicians or in healthcare does the same thing. We know that antibiotic resistance can happen naturally as organisms just adapt. So I think the time has come, rather than to try to blame one group over another, that we step forward and say, we probably are responsible for the creation of new antimicrobial resistant organisms. This is the time then to talk about a One Health strategy of sitting on the same side of the table, if you will, and devising new strategies of how we use antibiotics, right? And where there's misuse of antibiotics or overuse, that we correct those. And also we have to understand that international travel and trade may be a part of this, which could be a difficult part. But as we travel and transfer overseas and many different communities where over 1 billion people are moving internationally, we are bringing back with us in our own gut and on our skin new forms of antibiotic resistance, which add to this. So it's a good question, and I think it really is going to require some different changes of how people use antibiotics in the future and a new understanding.
Okay. Well, we've gotten some really some great questions dealing with the One Health concept. So I wanted to go into that since you had when you had answered the question. One of the questions that we had was specifically is could you talk about a few examples of where One Health has been used?
Sure. There's a good one that I alluded to, and that was taking several prototype communities. These are real studies, by the way, in East Africa, where there were major outbreaks of human rabies, and going through a strategy of working with villagers, of kind of local health officials, and putting out a major program to vaccinate domestic and wild dogs. And once that happened, the cases of human rabies dropped dramatically. And human rabies really are a disease of young children who are exposed, will move up to these animals in different ways. So here is a strategy, if you will, for eliminating or reducing rabies in animals, in this case dogs, because that was the major source, wild and domestic, that ended up with a major decrease in human rabies. Another one that I thought just to bring to attention is last year there's a celebration in place, and partly this year, of the elimination of an animal disease called rinderpest. And rinderpest was a huge problem several hundred years ago that really started the veterinary colleges, creation of veterinary colleges, and caused huge outbreaks of famine, especially in Europe and in Africa, because of these animals dying in huge numbers because of rinderpest. That it was exclusively an animal disease, but because there were lack of animals as a protein source, a number of, literally thousands of people died because of famine. So that disease now, along with smallpox, are the only two viral diseases that have ever been eliminated in the face of the earth. And the elimination of rinderpests from cattle, from water buffalo, wildlife populations then have allowed animals to be grown in Africa and other parts of the world when they're really needed in ways that they're more productive, adding to the food supply of humans, to their better nutrition, etc. And it really has saved numbers of lives because of better nutrition. So those are two One Health approaches.
Okay. We have had several questions dealing with veterinary medicine and then public health medicine. And I wanted to, one of the questions that we had, and I'm sorry, now of course I've lost this question, was specifically, are we going to see the concept of One Health being integrated into academia, such as the medical school, to try to pre-expose future medical and health professionals to increase in cross-species diseases and the future risks that we may face with the changing climate?
That's a great question, and it's right on. And if you remember the definition of One Health, we really talk about how we work collaboratively across disciplines and across professions, and that is a key strategy to One Health. I think up till today, and we're now seeing changes, but up till today, I think health professionals, especially on the human side, are being trained to look at diagnosing a disease, giving the right intervention or strategy, and then looking at what the outcome is. And we need to step back, and there needs to be an appreciation of these factors that may be as part of the humans and animals where the real intervention needs to take place. Probably in the middle 1800s to the late 1800s, when One Health really became kind of understood through Louis Pasteur and Virchow and a number of others, the importance, that we've lost that importance as medicine has become really overly specialized. So when you become overly specialized, and we're benefits of having great health care, but there's been a lack of understanding then of how these diseases can be transmitted before they get into humans, and an appreciation that we need to bring a whole community of health workers together, not only to understand this concept, but also to put together new strategies. And part of that is a new way of training and educated health professionals so that they appreciate that they have to bring different teams together to do this. And I don't think we've done that very well. And there's a move afoot, I think, in a number of, certainly in veterinary schools, but in some medical schools and in schools of public health where this is done. For example, at Ohio State, we have 7 health science colleges, the only comprehensive university with 7. And we're talking about, how these 7 colleges relate, how we can have interprofessional training across all the students in these 7 colleges that appreciate this concept, and especially appreciate team science and team medicine.
Okay, I have 2 more questions I would like to try to get in. One is from a middle school. They are asking, it seems as if the human population is experiencing a boom. Do you feel as if the increase in human-animal interface and disease is simply a way to balance out the human population since we really have no predators?
So I know it would take a middle school class to stump me. That's a great question. There are people that opine to believe that if something doesn't happen in terms of our population growth and our ability to deal with that we are just moving toward a huge global epidemic that will move in and basically change the world population so it's more apt to deal with this interface. So that would suggest that we'd get a huge disease outbreak like we did in 1918 or 1990 that would unfortunately wipe out a large number of people or animals to really rebalance, if you will, this system to make it more in balance where survival will take place. We hope that never happens, but we are on the pathway with 30 billion animals and 7 billion people in an interconnected world where an outbreak like we're talking about could happen. There's a movie that came out a little while ago called Contagion that kind of played that in a fictional way. But that movie was based on a disease called Nipah virus, which was the real thing. So a great question, and we hope that we can do some better interventions so that we don't kind of move into a world highly vulnerable where one of these global epidemics will really wipe out millions of our population.
Well, thank you. One more question, just if you don't mind, dealing specifically with as it relates to climate change. With temperatures increasing due to climate change, what do you see as the biggest issues facing public health and food production, and what should our public health departments do to help prevent or mitigate for some of those problems that as we face some of these infectious diseases?
So yeah, I mean, we're really trying to come to grips with that. There's no question that movements of animals will change because of climate change, and certainly the movement of wildlife. Crops and animals may be grown in areas that have been way too cold now for their sustainability that in the future will be sustainable, which could increase production systems. Or some areas will be created where maybe food won't be able to produce unless we have special kinds of genetic strains. My big concern about weather change is the water supply. That as we grow more animals and agriculture increases, the water amount that's needed to sustain that has to increase. As the number of people increase, the water has to also increase. And I think that may be one of the issues that we will see sooner than the long-term change in temperature, but they are closely related. and waterborne diseases and the change in the development of a group of diseases in food safety and foodborne and waterborne diseases, I think we will see first as one of the consequences, and it's where public health needs to start paying more attention.
Okay, thank you. Well, I wanted to wrap up. We're past 1 o'clock. I wanted to thank Dr. King for his willingness to talk with us today about the One Health concept, a great discussion. I also want to thank NOAA and National Sea Grant College Program for funding this webinar. I did want to remind you that our survey URL for this webinar is in the chat feature, so please take a few minutes to fill that out. We would like your input as we develop a regional climate site, so please take the time if you could. I also wanted to refer you to resources and an archive of all the previous webinar presentations, which are located on our changingclimate.osu.edu website. This webinar series is sponsored by the OSU Climate Change Outreach Team, and it will continue next month. We'll send out a notification when registration is available. Thank you again to Dr. King and all the participants on this webinar. We hope that this was beneficial and hope you'll join us again in an upcoming webinar. Thank you again, Dr. King, and everyone have a great afternoon.